Death, infinity.
Good afternoon, and welcome to the Your Health television program here on AMP's Cable Channel 24 and on the internet at www.ampmedia.org. Join our rotating host and their informative guest live every Monday afternoon at 4 o'clock. The purpose of the Your Health television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Hi, welcome to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today and just about every third Monday of each month. April marks Alcohol Awareness Month, a nationwide campaign intended to raise awareness of the health and social problems that excessive alcohol consumption can cause for individuals, their families, and their communities. The definition of excessive drinking includes heavy drinking, which is 1 drink per day on average for women and 2 drinks for men, and or binge drinking, which is 4 or more drinks in one sitting for women and 5 or more for men. Excessive drinking is responsible for approximately 80,000 deaths each year in the United States and has immediate effects that increase the risk of harmful health conditions such as unintentional injuries, including traffic injuries, falls, drownings, etc., violence, risky sexual behaviors, miscarriage and stillbirth among pregnant women, and alcohol poisoning. Over time, excessive alcohol use can even lead to the development of chronic diseases, neurological impairments, and social problems. Luckily, preventing alcohol use and abuse is a priority here in Monterey County. Today, we are going to hear from 3 guest experts who are all collaborating to reduce alcohol abuse to protect the health, safety, and quality of life for all Monterey County residents, especially youth. With that, I'd like to welcome my first guest to the program. Sitting across from me now is Ms. Rose Moreno, the Alcohol and Drug Prevention Programs Coordinator for the Monterey County Behavioral Health Bureau. Welcome, Rose, and thank you so much for being here.
Hi, thank you for having me.
So, Rose, what is the relationship between behavioral health and the alcohol and drug prevention programs? And what are the goals of the programs?
Well, Monterey County Health Department's Behavioral Health Bureau actually receives substance abuse prevention treatment funding from the state. And with that funding, we utilize it to contract for local prevention services here in Monterey County. AOD prevention services, they seek to improve the quality of life for everyone living within Monterey County by providing services that address issues within our community. Issues can include underage drinking to youth drug abuse. We contract with 2 local agencies at Sunrise House and Sun Street Centers, and each of those agencies are subject matter experts in AOD prevention, or alcohol and drug program prevention. And Sun Street Centers covers the Peninsula and South County regions, whereas Sunrise House covers the Salinas region. Dr. Wayne Clark, our Director of Behavioral Health, is aware of how early intervention services impact our community and is a strong supporter of public policies such as a social host ordinance, for example, and a firm believer in offering prevention type of services to youth before it reaches treatment type of services.
Okay, great. So behavioral health basically at the county health department kind of structures and coordinates these programs and works with local service providers to implement them in the community.
Exactly, and you know what I'll be touching upon later in the segment is the 5-year plan that the county has to submit to the state, and in that plan it identifies the needs of the community, and from there I work with the providers to come up with a plan to provide the services that are going to reduce, for example, underage drinking.
Okay, great. So what is your role as the Alcohol and Drug Prevention Programs Coordinator for the Monterey County Behavioral Health Bureau?
Actually, I serve 2 roles. One is the contract analyst for AOD prevention services, and so my role is to contract with each of the providers in order to provide prevention services to our youth in the community. One of my big roles is to ensure that we're meeting state requirements and that we're also providing services that are actually going to produce positive outcomes. As a AOD program prevention coordinator, I work directly with those providers as well to develop yearly work plans based on the Monterey County Strategic Framework Plan. And it's my job to ensure that quality prevention services are being offered to individuals in our community and that prevention services provided are making a difference.
Okay, so not only do you do some of the budget, contract, kind of administrative functions, but you're down there in the muck with everyone. You're working it out.
Exactly,
Yep.
yeah. And you know, that I think for me that's one of the best or one of the most enjoyable parts of my job is actually working with the providers, going out there and talking to members of the community to ensure that the services being provided are quality services, you know, that are making a difference in our community.
Great, great. All about outcomes. So what is the County Strategic Prevention Framework Plan, and what are the goals of that plan? I think you mentioned that just now.
The Strategic Prevention Framework Plan, or what we call an SPF plan, is a local 5-year plan that identifies key alcohol and drug problems within the community. Now, some of the data that we use comes from the Department of Education under the California Healthy Kids Survey. We obtain local data from law enforcement, along with state data from alcohol and drug prevention services. And we also obtain data sometimes from other departments within the county, such as Department of Social and Employment Services or Probation Department, et cetera. Some of the issues that we identified in this last 5-year plan include underage alcohol use for youth, alcohol and drug-related crime and violence, and the prevalence of marijuana use among youth. And so the goal of our 5-year plan, which is coming to an end on June 30th of this year, is to reduce each of these issues by 5% over time. And so that's what I'm working with each of the providers to ensure that, again, the services that we're providing are going to help us meet this goal and achieve the outcomes that we said that we would do.
Okay, great. So those goals there are measurable. And
Exactly.
You mentioned that you've reviewed data from a number of sources and created these goals, and that 5-year plan is almost up. Now, you and I talked before this, you know, a few weeks ago, and it's to move forward with another 5-year plan, you're going to conduct a needs assessment.
Exactly.
And then create another 5-year plan.
Exactly. We'll take a look at the data again in terms of outcomes. We're actually having somebody from the state come to talk to us about the outcomes and to help us determine whether whether the goals should be the same or whether we should tweak some of the other goals. One of the things that I've been looking at is wanting to add an additional goal of tobacco use among youth, because I know that's been a huge issue here in this county. And so once I collect the data and we can go ahead and justify those needs for services, then we'll go ahead and revise the SPF plan.
Awesome. So how are the alcohol and drug prevention programs meeting the goals of the strategic plan?
So what we've done is, like I said, we've contracted with each of our providers who literally provide various prevention services, and we've created a work plan that aligns with that strategic prevention framework plan for the county. We at Behavioral Health, we recognize that the problems identified in the local plan are pretty much a threat to the public health of the community, so we want to ensure that the services provided by Sunrise House and Sun Street Centers meet the goals of reducing underage drinking by 5%, but they also provide educational type of information to individuals so that, again, we can pretty much stop it at a prevention level and not let it escalate to a treatment type of service.
Okay, so prevention, interventions,
exactly,
are the key here.
Right, prior before it hits treatment, because we do have alcohol and drug treatment services, but that's where we want to kind of curtail that with providing prevention and intervention type of services.
Right, and we know those treatment services are so much more expensive as well,
yes, exactly,
costly than the prevention services.
Right, and a lot of times I know that it's counterintuitive, but we tend to invest more in treatment. So at this, Dr. Clark likes to, kind of blend and pool and braid, different funding services or funding rather to provide prevention type of services to the youth in the community, so that way we can, again, curtail treatment.
Wonderful. So currently you're working on, you mentioned this briefly a few minutes ago, but currently you're working on a countywide social host ordinance. Tell me, what is social hosting?
Well, social hosting holds either the host of a party or the owner of the property responsible for any underage drinking, regardless of who provided the alcohol. Social hosting could be at a private residence. It could be during a quinceañera at a hall. So rented hall, it could also be at a motel or a hotel room. But it's when a private citizen provides underage youth with alcohol. The ordinance that we'll be working on will cover unincorporated areas of the county so that we catch that loophole. Currently, Sun Street Centers has been working with a few of the municipalities, cities in the county to pass local social host ordinances. And so we're working with them to catch that loophole.
Okay, to make sure there's full coverage throughout the county. That's what you had said, because the county can kind of maintain the unincorporated areas while we work with the cities to ensure that they are on board as well.
Right. So some of the research I've done, 14 counties in California have adopted a social host ordinance along with 62 cities, and that number is growing over time. A lot of the cities have used a Ventura County model as their template for creating the ordinance, because it includes your choice of including either civil penalty or response cost recoveries or even an infraction. At this point, we have the county municipal code already set in place. However, it only has some elements of a social host ordinance, but it doesn't have everything in it. So what we'd like to do is add a civil penalty and response cost recoveries to that.
Okay, and so let's back up for 1 second. Social hosting. Any time an individual, a private citizen, has alcohol and is providing it to minors.
Right.
So it's basically like, I don't mind if you guys drink, it just has to be under my roof or something like that. That's the whole...
It's the misperception that drinking, and that a lot of many individuals have, in that, well, if they drink under my roof, it'll be safer.
Okay.
Or it's a rite of passage.
Oh, okay.
Right? And then being that we're coming to June, which is graduation month, a lot of parties will be taking place, and a lot of, alcohol will be purchased for, underage drinkers, so we want to get that message across that it isn't safe to provide alcohol under, a private residence. I mean, people do still get in the car and they drive, and that, I know, in Monterey County has caused a number of incidences to occur, tragic incidences to occur, And so again, it speaks to a public health issue in that it not only is detrimental to the youth who are drinking, who are underage, but it also is detrimental to the citizens who are out there on the road.
Maybe not going to a graduation party.
Right. They do say that access to alcohol increases, especially at residences. Youth have always said that it's easier for me to get alcohol or to obtain alcohol at home.
Oh.
And a lot of times, as you stated before, there are incidences where there's a high increase of violence, there's a high increase of sexual assault, and there's a high increase of alcohol poisoning that occurs as well. So we want to kind of stop that.
So, and that's why, I guess I'm assuming such an ordinance is needed here. It's not been done before, and it's needed because clearly you're telling me this happens more than... I was surprised to find out that, home is the easiest place to get alcohol.
To gain it. Yeah, the Department of Education, they fund the California Healthy Kids Survey, and it's conducted every 2 years, and it's conducted at the local level in each of the counties. And from there, they glean information usually to identify trends at the local level regarding alcohol use, drug use, and violence. And so these past 2 years that they did it, I think was 08, 09, and 9, 10, some of the results for our local Healthy Kids Survey stated, one of the questions was rather, how many times have you consumed alcohol 4 or more times during their life? And it was astonishing because 44% of our 11th graders and 65% of our non-traditional students who are continuation in day school stated that they've had consumed alcohol 4 or more times during their life. So that was a high number. It really does coincide with the issues going on at the state level with other counties as well. And so one of the other important questions asked is, how easy do you feel is it to obtain alcohol? And so in this case, 53% of ninth graders and 44% of non-traditional students stated that it was very easy to obtain alcohol. So we're getting it from the actual youth's perspective, is how it's very easy to obtain alcohol, and they've actually experimented with it over, their lifetime.
And so this is ninth grade. 14, 15,
Exactly.
16, 17?
Yeah.
So that's
Yeah,
not
definitely
21.
under the age of 21. Yeah, I've actually been working with Sun Street Centers and Sunrise House on a community-wide perception survey regarding the ordinance. And so currently we're tabulating the results, but I did do South County, and one of the questions in that was, would you support an ordinance that had a civil penalty in it? And 68% of individuals we surveyed in South County stated that they would support such an ordinance because they realize that this is an issue that's been occurring, you know, in different pockets of the county.
And so a civil penalty basically is being penalized for doing...
For serving alcohol to underage minors.
Okay, and then a response, a response cost recovery you mentioned earlier. What is that, and why is that needed?
Well, a response cost recovery is when law enforcement is called, and then it has to go to a house party to disperse it.
Oh.
And a lot of times what happens is that it takes away time from other types of emergency calls. And so it takes away not only time, but it takes away manpower and it takes away money. So that would also be added into the ordinance as part of the responsibility of the person being cited to pay for.
Okay, and then so regarding the civil penalty and the response cost recovery, you surveyed for this in your community acceptance survey, and the community was willing to deal with these things.
So far, all the data I've looked at, they've been very supportive of such an ordinance because they realize again that it isn't okay to serve alcohol to underage minors.
Yeah. And so, Rose, what other services are offered by the Behavioral Health Bureau that address alcohol awareness?
Oh, sure. We actually work, again, with Sun Street Centers, Sunrise House, and some of our other contractors, including Community and Human Services, provides the DAISY program, which is the Drug Abuse Intervention Services for Youth program, and that provides intervention and education for our 6th to 9th graders. We at Behavioral Health also work with the Department of Social and Employment Services, probation, the Sheriff's Department, et cetera, to provide various programs throughout the community that will address all of these issues that I spoke about today.
Wonderful. Well, Rose, I want to thank you again for taking the time to talk with me today. It's been a really informative discussion. Some of those numbers that you just kind of...
They're a little alarming, right?
They are a little alarming. I had no idea. I mean, that's pretty young to be...
Yeah, exactly. So I'm hoping that, there will be enough support for the ordinance that, we'll be able to get it adopted and set in place.
Oh, I hope so, too. So for our viewers, for more information on anything you just heard, including the Strategic Prevention Framework Plan, visit the Behavioral Health Bureau online at www.mtyhd.org. That's www.mtyhd.org. And right now we're going to take a short break, but don't touch that dial. We'll be back in just a moment with more of the Your Health television program.